Hello, dear professors, colleagues, and researchers from different fields of social sciences and health sciences in particular. Thank you for your attendance and interest in this present paper. My name is Ammari. I'm a PhD student from the University of Hassan First, specifically from the Laboratory of Health Sciences and Technologies and the Higher Institute of Health Sciences. My topic of research is professional identity and the ethical foundations of nursing. And in this presentation, I would like to offer you insights into the development of nursing professional identity in Morocco. The significance of this paper lays in its use of the complexity of the concept of professional identity to evaluate the situation of nursing in Morocco and provide insight into the major areas of interest for research and interventions that are conducive to major developments within nursing and, by extension, the achievement of national and international healthcare goals. So, more than 50% of healthcare professionals are nurses. In Morocco specifically, 56% of health professionals are nurses, and they contain a major capital essential for keeping the resilience and stability of healthcare structures. However, this much esteemed capital is documented to be under major stressors with large demand but accompanied with worker shortage. This is exacerbated by the globalization and brain drain and retirement rates. Professional identity and its development have been associated with worker retention, job satisfaction, good quality care, development of collaborative working atmosphere, and achieving nursing goals, which means that the development and growth of professional identity and focus on it could become a sort of resilience builder and an antidote to the changes and transitions and stressors that are put on professionals in their clinical environments. Nursing professional identity, as I have mentioned, contains a lot of nuance and complexity and involves the development of growth and maturation of the person within the elements of the context in which they work and the socio-historical aspects. The recent attempt to conceptualize professional identity comes from Fitzgerald, and she contends that there are 5 factors that interplay with each other and form a nurse's professional identity. This contains actions and behaviors, knowledge and skills, values, beliefs and ethics, context and socialization, group and personal identity. And so we find that the same interaction between the self, the concept of other, or the interprofessional relationships are still in interplay within a certain context. And this is in alignment with social identity theory and also role identity theory. So we find that these concepts are all congruent with each other. The aim of this study was to examine the current state of professional identity in the Moroccan context and introduce critical priorities for its progress. By aligning the current state of Moroccan nursing development with recent substantial literature, we tried to emphasize major areas of priority that would lead to rapid growth and establishing nursing as a profession. The method that we used was a review and synthesis of the recent and significant scientific literature. Now, for the developments of Moroccan healthcare system, we have 3 major elements that are in interplay with each other. First of all, we have the social political reforms, starting from the Moroccan Constitution of 2011. This has led to the development of a 2025 health plan that was established in 2018 and maintained a lot of data and information around how do we develop a person-centered care within the Moroccan healthcare system. And this is obviously something that included nursing, as it is a major component of the healthcare system. Morocco has also been involved in international agreements with the World Health Organization, aiming to achieve universal health coverage, which is currently in the process of being established. And also the involvement with the United Nations Sustainable Developmental Goals, especially SDG 3, that aims to ensure healthy lives and promote well-being for all at all ages. Obviously, these developments have impacted nursing and have motivated a lot of reforms. Mainly we have a initial legal framing of nursing, and we also have the conversion of nursing certification into a university-based diploma, which allows nurses to continue their education or further their education through master's and PhD programs. As I have mentioned, Morocco has created or formulated a 2025 healthcare plan. For example, we're talking about development of professionalism, clarifying descriptions of role profiles for healthcare professionals, formulation of integrated and continued care, humanization of healthcare structures with competency and empathy. There are a lot of challenges that has been acknowledged to achieve these goals when it comes to nursing, because there's a lot of recognition of quantitative and qualitative deficits in the nursing workforce, because of shortage of public health funding, private sector competition, and also, as I have mentioned, the brain drain and globalization, with the addition of retirement rates. And in the following, I'm going to talk about the different points of interest and priority for nursing research and areas of investment that are needed to develop nursing professional identity. First of all, the knowledge base of nursing. The development of nursing, in the example of the United States, one of the pioneers in the development of nursing, has started or was initiated by the change and shift to university-based education. This shift has led to major breakthroughs in the knowledge base of nursing, beginning of the late 60s and 70s, and today have reached a level of developing middle-range theories and expansion into evidence-based practice and situation-specific theories. Now, if we want to achieve the same results within the context of Morocco, we have to understand the different constituents that have led to this achievement, from the institutional legitimacy and academic autonomy, meaning the development of nursing as a science with its own phenomena of research, ontological and epistemological and methodological approaches that are essential for it, that have to be also included within the education of student nurses. There's still a lot of challenges that are documented within nursing literature, mainly the theory versus practice issue and nursing programs remaining largely technical and do not focus on the knowledge base that precedes actions. Socialization has a large impact on student nurses and professionals alike, but there's a lot of observed issue of recognition of nursing within the social realm that has been documented in scientific literature. Mainly, this lack of recognition goes back into the presence of numerous negative stereotypes and also the presence of cognitive unobservable aspects of nursing that are not really recognized by the general population. Positive socialization has been known to promote significant involvement of student nurses within their studies and develop long-term job satisfaction later on and cultivate a positive social image. The literature provides significant arguments for the necessity to secure empirical evidence surrounding the socialization of nursing students into their profession in Morocco, and inform educators and supervisors about their role to provide students with a positive self-concept, now that we understand that it is very crucial to the formation of their nursing identity. Although there was a formal publication of a Moroccan nursing legal frame in 2016 that attempted to define nursing, the subordination to medicine is still prominent and acknowledged, and also there's a recognition of the absence of a national council and a national order of nurses. The literature provides a plethora of clarifications on how regulations affect the nursing role, just as the political, cultural, and historical realities that surround professionals. The presence of limitations allows for the acknowledgement of the responsibilities of the professional role, which allows for self-confidence and feelings of empowerment that reinforce a positive self-image. A lot of authors mention that the consideration of role responsibilities is a result of a well-developed professional identity, because having a strong professional identity allows for nurses to take care of the person as a whole and meet their needs fully. There's a lack of self-regulation in Moroccan nursing, and this lack of self-regulation has been reported to be an obstacle to professionalization. It is outside the realm of this discussion, but it's worth mentioning that there's a lot of debate around the concept of autonomy itself and how far nursing could really achieve autonomy, as it is bound to be associated and impacted by medicine. The final point of interest, and one of the major and essential components of professional identity, is the ethical components of nursing. The legal frame for Moroccan nursing mentions the requirements for respecting principles of morality, dignity, probity, integrity, selflessness, and professional ethics, as well as maintaining professional secrecy. But there's a lack of evaluation on the practical applications of these ethical values and foundations. The context of practice is very much nuanced, with values that are impacted by cultural aspects. The differences in values can lead to conflicts with detrimental consequences that can range from stress, anxiety, burnout, and even resignation, and ultimately poor patient care and failure to meet the standards and goals of the profession. The role of ethics is major for nursing. It serves mainly two needs, an internal one and an external one. Internally, professional ethics, or formal or normative ethics, serve to explicitly introduce professional values, responsibilities, and duties, as well as the rights of professionals. And externally, there's a need to inform the public of what to expect when being treated and cared for by nurses. And so, this is one of the essential high priority components that are conducive to developing professional identity and thus serving the realization of national and international healthcare goals. So, to conclude this presentation, for the Moroccan context, university-based education is a significant step towards nursing professionalization and could be leveraged to lead to significant positive outcomes associated with the development of the knowledge base, improving social image, autonomy, structuring of professional ethics. The presence of empirical evidence is, however, extremely crucial for the utilization of this nursing knowledge in decision-making and to make contributions that are practical and useful for the overall progress and achievement of healthcare goals, which means that nursing research is a critical path to aid the development of nursing as a profession and reduce the theory versus practice gap. Thank you.